a lot of material, but like people have survived in the past, so you guys are going to survive too. So don't worry, but you do need to like keep on top of it, but it's doable. So no big questions. Dissections are going okay, despite the lab manuals. Yeah. So there's resources out there. There's videos. I just used lecture notes and brought it to lab, because that's kind of like the most important things that you need to know. Whatever's in the dissection guides, I don't think like is pertinent information.
And we'll try to point out the main things that they focus on, because there's a lot of material in those dissection guides, and I'm telling you guys, like 3/4 of it is not relevant at all. And we've spoken to Ari about it. Can you please change the dissection guides? But he hasn't gotten around to it yet. So, yeah. So no questions. Everyone feeling okay?
Not the right.
It'll be fine. So. Okay. So who can tell me what this is?
Stomach.
Okay. So do you guys know how to orient yourselves with this?
No. Esophagus.
So what part of the ruminant stomach is this?
Reticulum.
Oh yeah, sorry. My bad.
Reticulum.
This part. Yep. So if he just reticulum, yeah. So reticulum means honeycomb. So it has this honeycomb appearance on the inside. Do you guys know what part of the stomach this is? Like how you would orient yourself?
Yeah. So if he like puts this on the table like this and inside out, that's probably the best way to orient yourself, because you need to like be able to assign different sides to things based on that. So that's a good starting point.
So what is this? I'll try to turn it.
Omentum.
So what side of the stomach would this be?
Right.
So this is a question that we got asked. He asked, which part of the ruminant stomach cannot be seen from the left side? The omasum. That's the only part that you cannot see from the left side. I don't know how it's relevant, but yes, it's.
Yeah.
What's this part?
Abomasum.
And then this, the rest of it. So you guys just did the grooves in class, right?
Yes.
You guys want to go through some of them? Yes. So what side did we say this was?
The left.
Yeah. So what would this guy be?
Left longitudinal.
Yeah. And he's very big on details in this course. So if he tags this, he's going to want left longitudinal groove. So as, yeah.
When you ask questions, can you repeat the answer? Because this far back on here is my...
Oh yeah, sure, no worries.
I'm recording it just so. Is that okay? I didn't ask you guys.
So this is the left longitudinal groove. Do you guys know what this guy is right here?
Accessory groove?
Yes.
Ventral
that would be
accessory
your
groove?
Left accessory groove. You guys see?
Left.
Left accessory groove. Yeah? What's this guy right here? Heard it. Coronary. Yeah, close. So you have your left dorsal coronary groove. Can you guys see? You guys can come up at the end too, and I'll go over this because I know it's really hard to see. And then this would be your left ventral coronary groove. You guys good with that right here?
So this specimen, just so you know, is in the bone room, and you have the diagrams from the lecture material, so it's useful to just come in, look at it, see if you could do that on your own. You'll need to do it with the wet specimen, which is probably a little less obvious than this one. So definitely know that in or out. We were saying before, like probably 10% of our midterm was just on the ruminant grooves and fillers and whatnot, so know it really well. Have this.
Okay, so what would this guy be?
My natural
Right
seating.
longitudinal. There. Right longitudinal. Okay. Do you guys know what this one is right here?
Right.
Yep. Right accessory groove. So what is this thing that is bounded
The
by?
island.
Yes, the island of. Yes, good job. So this area right here.
Also known as insular ruminous.
And we asked him whether we had to use like insular ruminous or island of the rumen, and he said he doesn't care. You can say whichever one works best for you, whichever is easier to remember. What's this? And if he put a string around this part right here, what do you guys call this part? Yeah, caudal transverse pillar, or groove, sorry, caudal transverse groove, right here. And then your cranial transverse groove is right here.
Okay, so all these grooves that we're talking about, if this was cut open and we were seeing it from the inside, what would it be called?
Pillars.
Okay, good. Except for what structure? Good, good.
So what's this right here? Do you guys know? Yeah. Ruminal reticular groove. So just like look at where it's between. So you have your rumen here and your reticulum here. It's the groove between those two, so it's the ruminal reticular groove. Okay. Have you guys done the internal structure yet? No. Should we just do it?
Sure. Go over a couple things.
Sorry, can you hand me that one? Thank you. Okay, so he also told us that he could cut a piece out of any of these specimens. So like this, for example, and just put it on the table and be like, what part of the ruminant stomach is that from and why?
Good. Good.
What about this one? Do you guys know what these are called?
Okay.
What about these? Do you know what these are called? Yes. So this is your omasum right here, and these are your omasal laminae or omasal leaves. They were named that way because they look like leaves in a book that like fit together. Do you guys know what the space is between the leaves? Because he has tagged that before as well. Just like shoves a piece of paper in there.
What is this?
Yeah. So that is, does anyone know? No, so this is your interlaminar recess. So inter means between, so between the laminae. The space between the laminae, basically. That's it.
That's more or less it.
What are these? First of all, which part of the stomach is this? You guys know? Yeah.
And what's the true stomach of a ruminant?
What are these things called inside of the abomasum? Yeah, so abomasal folds. Again, be really specific with him. So if he tags one, say abomasal fold. Don't just say fold. So those are I think the main things you need to know. You need to know reticular crests. That's what the honeycomb structures are called. Reticular crests, ruminal papillae, omasal laminae, and abomasal folds. Those are the overall internal structures of the stomach. And he does like tagging those. You can tag any.
And do you guys know what the reticular crests make? What is in between them? The reticular cells. So if he tags like this ridge, that's the reticular crest. Inside is the reticular cell. So just pay close attention when you're answering questions like that.
Sorry?
Cell
That's it. Okay, so the reason we put this out here is because he starts with the skin derivatives lecture for you guys, right? And he tagged this for us on our midterm. what would you guys call this? Yeah. So some people wrote horn, and he's like, that's wrong, because the horn is the derivative from the skin. So you have to say cornual process of the frontal bone. Yeah. You guys will get used to it, don't worry, kids. Stressed me out the first time too. So this is your frontal bone, and this process is actually an extension out from your frontal bone. So cornual means horn, so cornual process of the frontal bone. Cool? Let's do the wet specimen. So we're just going to go over the main things that he stressed for us, but again, he could change it, but it's been pretty consistent for the past few terms now from what we've been told. So what is... What is this whole muscle right here? Brachiocephalicus. Yeah. So what are the different parts of the brachiocephalicus? Okay, so what part is this? Yeah. And what is this entire part? Which is, it has two parts. What are they? Yeah. So they're not really divided very well on this specimen, but your occipitalis part is going to go to your occipital bone, which you guys know is at the back of the head. So that would be this part right here. And then your cleidomastoideus is just this part down here. But he doesn't really ask you to differentiate between those, or at least he didn't for us. You could just say cleidocephalicus, and he gave people the points for that. Say this guy was, yeah. What's this guy?
It's going sternum.
Yes. Sternomastoideus. So, first of all, how do you guys know if this is a sheep or a goat? Yeah. So what was the name of that sinus?
The infraorbital.
Yeah, good job. So just like literally just stick your finger in like right before the eye, and if there's a depression there, it's a sheep, because that's your infraorbital sinus. Goats don't have that. Because sometimes they'll ask you on like the midterm or the final, like what species this is, and that's one way you can tell. What's another way to differentiate a goat from a sheep? And then do you guys know the muscle that's only present in the goat but not the sheep? Sternal. Yeah. Have you guys seen a goat yet? Yeah. Okay, because I can pretty much 100% guarantee he will tag sternomandibularis. He loves it. So basically it runs right here. If you see any muscle basically in the cheek area of the goat, that's your sternomandibularis muscle. It's also known as the sternozygomaticus, if that helps you guys, because it comes from the zygomatic arch, which is on the side of the face. That's not really relevant, but that helped me remember it better. Let's see.
So do you guys know the boundaries of the jugular groove?
No.
Okay. At some point in time, it would be good to know that. Okay. So you have sternomastoideus.
Say it louder.
Sternomastoideus, the cleidocephalicus, and I think the
Hyoideus. Yeah.
Perfect.
Good job. So what is this? If he put like a string around this entire structure, what would you guys say? Yes. Specifically, I think what he wanted from us was common carotid artery and vagosympathetic trunk. Because he likes doing that a lot. He'll put like a string around two structures and then see who's paying attention. He will give half points if you put one, but he wants both. Okay. So what else is found in the carotid sheath? Yes. And that's important. You don't have to worry about it yet, but the horse doesn't have an internal jugular vein, so that's just another species difference that he likes testing. What else? Can you think of anything else? Because I'm pretty sure...
Yeah, I would say just know those, what's in the lecture material is more or less the structures that you need to know. There's all these other muscles that we learned in the dog. Maybe review them one time, but I wouldn't spend a whole lot of time identifying them.
Like I'm pretty sure we got tagged cleidomastoideus, sternomandibularis, and like one more. and that was between the lab exam and the final exam. So it was not a lot at all in this area. Yep.
Do you ever tag the bone muscles?
About those, you said greater auricular?
Yeah.
Where was that? Somewhere up here, right?
I was just wondering if he tagged them or not. Like,
No, I wouldn't cross them off your list.
Yeah.
I would say that's probably worth knowing, especially the great auricular.
Yeah, I think it's the
Yeah.
accessory right here.
Yeah.
Yeah, but for us, he didn't focus on any of that stuff, so it might be different for you guys, but I can ask him and let you guys know what he says.
Did he ask a lot of things from like that we did in term one that he just like expects obviously us for us to know for this, or is he more structured towards like differences and things like that?
I think he guides.
He likes this for some reason.
Yeah, he pointed that
So,
out. to us, too.
superficial cervical lymph node, and this is under your brachiocephalicus muscle. And in ruminants, the omotransverse serous muscle is pretty much fused with the brachiocephalicus, so you can't really distinguish them. So again, if you wanted to be tricky, he didn't do this with us, but he could tag this and want brachiocephalicus and omotransverse serous. Like he's done that before. Another thing too, for lab exams, make sure you say artery, nerve, muscle.
Yeah.
Even if you just write ANVM, whatever, just make sure he knows what you're talking about. Because he will take off half points and stuff for that. So it's not like Pasquini in term one.
I was gonna say all the stuff Pasquini didn't care about.
Has anyone actually dissected their limb yet?
Yeah.
Okay. So we'll save that for later.
Are the lab exams like they're like term one where you write like,
Yeah.
the answer down?
Mhm.
Because some people said it was multiple choice.
No.
Yeah.
I wish. Okay, so what's this right here? Yeah. So this is your external jugular vein, but they didn't actually inject any of these specimens, so it's really hard to see. But if you run your finger across it, you can see like fluid moving inside of it. So that's your external jugular vein. That's my other tip. Wear gloves for your lab exams and like get in there on the specimens, because the ones that he doesn't want you to touch, he'll specifically say do not touch next to it, but you can pick up the rest and like look at it and do all that stuff. Because he likes to be kind of tricky on the lab exams, so just make sure you know what you're looking at, like get in there. Okay, good. I think that was it. Oh, what's this? This thing. Nuchal ligament.
Oh yeah.
And which species does not have a no worries. Which species does not have a nuchal ligament? He likes that question as well. That's definitely come up before. Anything else?
Also more for the lecture, know all the different parts of the nuchal ligament and what's paired and what's not paired, because it will, the more species